your child is having a hard time sleeping or breathing, the first thing you need to do is look to see what's happening with their nose. A lot of times I recommend checking dust, dairy, dander. So do you have pets in the room? Are they having a lot of phlegm? Are they having some sensitivities to milk? Not everybody has an allergy to milk, but they can have sensitivity, creating more phlegm, creating more mucus. And how is the dust in their room? So that's one thing that I look at. How many stuffed animals are on their bed? Because stuffed animals have a lot of dust, which is what was happening with my daughter. So something that I didn't know about was you can do nasal hygiene. So these are clear drops. There is one that has a little elephant on the bottle. That is the kids one. So this one you can squirt up your nose. I don't necessarily like this one because it's a lot up my nose. So I prefer the drops. You just put one drop in each nostril and that'll help clear out your nose. If you don't like putting stuff up your nose, you can take a warm washcloth and put it on your nose before you go to sleep, and just make sure that you've blown out your nose, you've cleared out your nose before you go to sleep, and that will help you sleep better if you do nasal hygiene. For infants, I recommend putting one drop up each nostril a couple of times a day when you change their diaper so they get used to that. I know when we were little, we used to use that little sucky thing and suck the boogers out of my daughter's nose, but I wish that we had these. I didn't know they had those back then. So nasal hygiene is something that's going to be really helpful to get your kids sleeping and breathing better.